Hello YouTube, I am Dr. Rabiul. I work as a lecturer of pathology in a medical college hospital and I am making this video for my students. Hope someone finds this helpful. Okay, now today's topic is Sickle Cell Disease. So what is Sickle Cell Disease? Okay, so before we go into the definition of sickle cell disease, I want you to know some basic concepts. Okay, the first thing is sickle cell disease is a disorder of hemoglobin. The second point is here an abnormal hemoglobin is produced which is called Hemoglobin S. And the third point I would like to say is that the red blood cell which contains this abnormal hemoglobin S, they can become sickle shaped when deoxygenated, and from there we got the term sickle cell disease. Okay, so now that we have cleared some basic concept, now we can define sickle cell disease. So in your textbook you will see a definition. Sickle cell disease is a common hereditary hemoglobinopathy that occurs primarily in the individuals of African descent. It occurs due to point mutation in the 6th codon of the beta globin gene. Whoa, it's a very long definition full of lot of biochemistry terms. Okay, so don't worry, we will discuss this definition step by step. So what did I say in the definition? First I said this is a hereditary hemoglobinopathy. Okay, now this is important. Always remember, disorders of hemoglobin are of two types. One is hemoglobinopathy, hemoglobinopathy, and the other one is thalassemia. Okay, both are disorders of hemoglobin, but they are not the same. Well, I have a separate lecture on thalassemia, but to say in short, thalassemia is a disorder of hemoglobin where we are making reduced number of globin chain of the hemoglobin, and in case of hemoglobinopathy we are making abnormal globin chains of the hemoglobin. Okay, so always keep these two things in the mind. Okay, so let's go back to the definition. Like I said, sickle cell disease is a common hereditary hemoglobinopathy. That means here we are having some abnormal hemoglobin formed. And what was the second part? It is predominantly seen in individuals of African descent. And how does this thing occur? It occurs due to point mutation. Okay, so I'm sure in your biochemistry classes you have learned about mutation. There are different types of mutation, and one of the types were point mutation. Okay, and that thing is occurring here, and what is happening as a result of that point mutation, we are having some problem in the beta globin chain. Okay, what's happening? There is an amino acid named glutamate that is getting replaced by another amino acid which is valine. Okay, so remember, hemoglobins are tetramers. Okay, so what do we mean by tetramers? Tetramers mean we are having four protein or 4 globin chains in every hemoglobin, and each of those globins are bound with their own heme. Okay, so in normal adults we have hemoglobin A, hemoglobin A2, and a very little amount of hemoglobin F may be present. And if you recall their structure, hemoglobin A had 2 alpha globin chain and 2 beta globin chain. Hemoglobin A2, it had 2 alpha globin chain and 2 delta globin chain. And the last one, hemoglobin F, 2 alpha and 2 gamma globin chain. So what's happening in sickle cell disease? We're having point mutation in the beta globin chain, and as a result we're having an abnormal beta globin chain, which we can write by adding an S over the beta. So this is the way we can write hemoglobin S. Okay, so now that we have defined sickle cell disease, now let's go further and we will discuss what happens when we are having hemoglobin S in our red blood cells. Okay, so basically hemoglobin S is an abnormal hemoglobin, and it has an interesting property. It tends to polymerize when deoxygenated. Okay, so what will that thing do? Well, do you know the function of red blood cell? Well, red blood cell has a lot of function, but its primary function is to transfer oxygen and carbon dioxide, right? It transports oxygen from lungs to the tissue and carbon dioxide from tissue to the lungs for gaseous exchange. And the way these RBCs transfer or transport these oxygen and carbon dioxide is by binding the gases with its hemoglobin. Okay, so hemoglobins, you know, they are like pickup trucks, you know, they are carrying supply from one place to another place, and then they're dumping those things. You know, for example, hemoglobins are collecting oxygen in the lungs and they're dumping oxygen in the tissue. Okay, so the point I'm trying to make here, hemoglobins are sometimes oxygenated and sometimes deoxygenated throughout their course. And the problem with hemoglobin S is whenever these hemoglobin S are deoxygenated, they tend to polymerize. Okay, so what will be the result of that polymerization? Well, do you know the shape of a normal red blood cell? As I have drawn, you can see this is a normal RBC viewed from the top. This is the same RBC viewed from the side, and you can see this is a biconcave circular disc-shaped structure, the normal red blood cell. But whenever the normal RBC is containing some abnormal hemoglobin, and whenever those hemoglobins are polymerized when deoxygenated, they change their shape, and the red blood cell becomes something like this, you know, like a sickle. Okay, I'm drawing it. It's still red in color, but it's now in a different shape. It's like a sickle or a boat shape. So this thing has transformed into this thing. Okay, so that is a problem. Now, what are the problems caused by the sickle cell? Okay, now we will discuss those problems one by one. Actually, this sickle cell will cause 3 problems. The first problem is hemolysis, that is breakdown of the red blood cell itself. So this is a red blood cell. It's sickle in shape, but it's still a red blood cell, and it will get destroyed quickly. That's one problem it's causing. The second problem is it will cause microvascular occlusion. Okay, There are a lot of microvasculature in our body, for example, in the bones, in the spleen, in the brain, kidney, liver, lungs. All those places it can cause occlusion. And surely you can see if there is hemolysis, there is microvascular occlusion. One thing it will also do is tissue damage. So we will discuss these three topics one by one. Okay. So how does sickle cell disease and hemoglobin S causes hemolysis? Well, I said in deoxygenated condition, when hemoglobins are deoxygenated, hemoglobin S tends to polymerize, and that changes the shape of the red blood cell from biconcave circular to sickle shape. So what? The thing is, you have to remember, when hemoglobin S is polymerizing, it's forming some needle shape structure. For example, suppose I am drawing hemoglobin here. Actually, hemoglobins are red in color, but in order for you to understand, I am drawing it in black. Okay, so this is just for understanding. Okay, so they are making these type of needle shape structure when polymerized. And what will happen? These needle shape structures will herniate through the cell membrane of the cell. Always remember, if we zoom this part, this is a cell. So all cell membranes are lipid bilayer. I am sure you have seen a picture like this in your physiology lectures, you know. These are lipid, these are also lipid. They form bilayer and they make the cell membrane of all cells, you know. So what's happening? These things, these needle-like structures are protruding through the cell membrane, and that will make the cell membrane leaky, and that will result in influx of calcium ion inside the sickle-shaped red blood cell. Okay, and when calcium enters the red blood cell, the sickle-shaped red blood cell, that will activate some ion channels. And what will happen then? That will result in efflux of potassium and water through those ion channels. That will make the sickle-shaped RBC dehydrated. Now, is that thing good for red blood cell? You know, a normal healthy red blood cell, it is a very beautiful cell, you know. It's a very dynamic cell. It's like a flying saucer, you know, the ones you see in the movie. It's flowing inside the blood vessel like a spaceship. It's so aerodynamic, it's so flexible. It can flow like a ship, and it can squeeze through the microvasculature when needed. But what happens when we are dehydrating the red blood cell? We are taking water away from it. We are taking potassium ion away from the red blood cell. The red blood cell will tend to become rigid. Normally, there is a fluid cytoplasm inside the normal RBC, but in case of sickle cell RBC, that will become more viscous. It will become more rigid. And the problem with that thing is that this particular rigid cell will be unable to pass out through the splenic circulation. Okay, so they will get stuck in the splenic circulation when they are too much rigid. Okay, now always remember, it's not like this that hemoglobin S is formed and they become rigid in one chance. It takes a lot of circle, you know. They are hemoglobin S inside RBC, so those RBCs are getting sickled, and then when those RBCs are going back to oxygen rich area, they are again reverting to this circular shape. But as this cycle, this sickling and desickling continues to occur, ultimately they will become very, very rigid, and then they will be detected by the spleen that these are not normal cells, and then the spleen will try to destroy those sickle-shaped RBC. The next problem these hemoglobin S and sickle-shaped cell will cause is microvascular occlusion. Okay, so microvascular occlusion will result in different symptoms based on which blood vessels are occluded. But one thing you have to remember, the mechanism of microvascular occlusion is still uncertain. Okay, it's not only the fact that they are sickle shape and they are getting stuck in the microvasculature. There are some other factors involved as well. For example, it is known that when RBC changes its shape from biconcave circular disc to sickle shape, it increases adhesion molecules on its surface. Okay, and also there are some other factors that can influence microvascular occlusion. One of the other factors is inflammation. You know, I'm sure you have heard in inflammation there are different stages, you know, and there is at first transient vasoconstriction, when the blood vessels around the site of injury as a reflex phenomena constricts rapidly for some time, and then there is vasodilation, which results in slowing of the blood flow or stasis of the blood flow. And whenever blood flow is getting slowed, then there is chance of occlusion. Okay, so sickle cell disease will cause microvascular occlusion. Now, what will be the problem? Well, the problem in the bone, the patient will complain of severe bone pain. Okay, and sometimes in young children, the bone pain may be very difficult to distinguish it from bone pain due to osteomyelitis. Okay, so we have to do other tests to confirm that the child is suffering from sickle cell disease and not from osteomyelitis. Okay, now what will be the clinical feature, say, if there is occlusion in the lungs, in the pulmonary circulation? You will see in your textbook there is a term written that is acute chest syndrome. Okay, so there will be acute chest syndrome. Patient will complain of chest pain. There will be dyspnea, wheezing, fever, etc. And there may be also some lung infiltrate, and those will result from these sickle cells occluding the pulmonary vasculature. Okay. Now, one interesting thing happens in the kidney. Okay, in the kidney, when there is this type of damage or microvascular occlusion, the kidney loses its power to concentrate urine. Okay, so those patients will get dehydrated very quickly. Okay, and also another type of vaso-occlusive crisis can occur in the hand and feet, that is known as hand-foot syndrome. There is actually different inflammation in the hand and foot due to microvascular occlusion. Okay, so as you can see, we are discussing a lot of clinical features that we can have in sickle cell disease. Okay, so the next thing is we have to know is how will we diagnose sickle cell disease. Okay, so there is a lot of ways of diagnosing sickle cell disease. Always remember, if you're having a patient with African American descent and the patient is complaining of hematuria, okay, so you just always do a screening test for sickle cell disease as well. Okay, now what will be the morphology of a patient who has sickle cell disease? Well, in the peripheral blood we will have sickle cell, we will have target cell, and also some other things. Okay, now I would like to pause here and say a thing or two about homozygous and heterozygous disease first, because that is important. Okay, now sickle cell disease, it can be homozygous or heterozygous. You know, the hemoglobin S we're talking about, that can be homozygous or heterozygous. So what do they mean? Well, suppose this is a chromosome. Okay, I'm sure you know what a chromosome is, and this is another chromosome. Okay, moreover, suppose both of them are chromosome number 11, and one came from the father, one came from the mother. Okay, we all know in diploid cell we have chromosomes in pairs, and one of those comes from the mother and one comes from the father. Moreover, suppose we're talking about a specific gene that is present in both of these chromosomes. Now, if there is mutation in either one of those genes, suppose there is mutation in this gene, I am drawing that part in red. Okay, this is called heterozygous mutation. Okay, one is healthy, one is not healthy. And if there is problem like this, then the patient will have sickle cell trait. Okay, sickle cell trait. And the thing is, that will be most of the time asymptomatic. Okay, the patient won't have a serious problem. And however, if both the genes are mutated, this is homozygous state. And actually the sickle cell disease we talked about, that's homozygous mutation. Okay, now one interesting thing you should know, that sickle cell disease, hemoglobin S gives us protection from falciparum malaria, and that's why there is an increased percentage of sickle cell trait in Africa. You know, Africa, there is a lot of prevalence of falciparum malaria. So we see in Africa there is almost 30% people, African people, almost 30% of them carrying heterozygous form of this sickle cell trait. Okay, so they don't have the disease, but they are protected against falciparum malaria. And you may be asking me how they are protected from the malaria. Well, simple. You see the RBC, we are destroying, the RBC is getting hemolyzed, you know, a little bit quicker. So that is making the malaria parasite unable to grow inside the red blood cell. Okay, so that is sickle cell trait. Okay, so now let's go back, and one thing I would like to add, you know, we're talking about hemoglobin S, and that is causing the sickling, but does RBC contain only hemoglobin S in a person with sickle cell disease? No. RBC also contains hemoglobin A in less amount. So you have to remember this thing, 60%. Whenever an RBC contains more than 60% hemoglobin S, that is the time when that specific RBC will become sickle cell when deoxygenated. Okay, that's why sickle cell trait don't show the disease, because in sickle cell trait we have very few amount of hemoglobin S, but in case of the sickle cell disease, which is the homozygous form of the disease, we have sometimes even 90% or more hemoglobin S, and that causes sickling and the other problems. Okay, so we're going back to the Morphology, how we will diagnose sickle cell disease. We will collect patient's blood, examine the peripheral blood film, and there we will see sickle cell. Okay. We will also see target cell. Okay. Now, target cell, this is actually an important finding for thalassemia. Okay. If we are talking about thalassemia, we surely have to see target cell in our peripheral blood film. However, always keep that in your mind, that target cell will be also seen in sickle cell disease as well. And the reason is, in sickle cell disease, we are making the cell dehydrated. Now, think of RBC as a basketball. You know, when you deflate a basketball, what happens? You see some blebbings, you know, on the ball. Similarly, when we are like dehydrating an RBC, sometimes the RBC makes some blebs, you know. Let me explain. For example, suppose this is an RBC viewed from the side. Okay, and suddenly I have dehydrated this RBC, and that will result in formation of bleb in the center. Okay, and then if we look at this RBC from the top, this is the side view. Now, if we look at these RBC from the top, what will we see? We will see a disc-shaped structure, but there will be a central dot, like a bullseye. Okay, and this is the target cell. So this is the reason why we will have target cell in sickle cell disease. Okay. Now, what will be the other findings? Well, we will also see something that is Haemoglobin bodies. Those are fragments of nucleus inside the cell. Okay, normally we don't see these type of fragment because those cells are either destroyed in the spleen, but here what's happening, always remember there is a term called autosplenectomy. That is, when we're having microvascular occlusion in the spleen, at first, since blood is getting stuck in the spleen is getting enlarged. But those bloods are not going anywhere. So in fact the spleen is not getting sufficient blood supply. You know, so ultimately the spleen will begin to infarct and begin to shrink in size. And not only in size but also in function. So as the function of the spleen will begin to decrease, we will begin to see these type of abnormal cells in the peripheral blood film. So that's the thing about Haemoglobin bodies. Okay. What will be the other findings we will see in lab diagnosis? Well, we will see bone marrow hyperplasia. Why? Simple, you know, we're having hemolysis. I said in the first point, the effects of hemoglobin S, first there was hemolysis, second microvascular occlusion, third tissue damage. So hemolysis, we know our bone marrow is the main site of hemopoiesis or blood cell production. So as the bone marrow is realizing that we are losing blood cells rapidly, it will try to compensate. And the only way the bone marrow will compensate is by increasing its production, and in order to increase production, bone marrow will increase its cell. There will be bone marrow hyperplasia. And always remember, suppose this is a bone marrow. Okay, so I will draw here. Suppose this is a bone. Just a very diagrammatic picture, and this is the marrow. This part is the bone marrow, and this is the cortex. Okay, so this is the cortex of the bone, and this is the bone marrow. So as we're having bone marrow hyperplasia, so this part is rapidly expanding. The bone marrow is rapidly expanding. Okay, so what will happen? Sometimes it will try to expand so rapidly that there will be some cracks. You know, the other parts can't keep up, so there will be some cracks in the bone, and this is called crew cut appearance or hair on end appearance, and sometimes you may also see that in sickle cell disease. So don't get confused if the examiner asks you about crew cut finding. Okay, so this is hair on end appearance in the bone marrow of a sickle cell disease patient. Okay, also remember, as there is a lot of hemolysis, you know what happens when RBC gets broken down? It releases the hemoglobin it contained, and then that hemoglobin gets further broken into a lot of substance. One of those substances is bilirubin, so there will be hyperbilirubinemia, increased bilirubin in the blood, and also there will be some pigment gallstone seen. Okay, so what is the screening test for sickle cell disease? The screening test, we do a test in which we try to consume oxygen out from the RBC and try to see what happens. Well, if the patient does not have sickle cell disease, nothing will happen. But if the patient has sickle cell disease, then when oxygen is taken away, when the hemoglobins are deoxygenated, they will form sickle. Okay, and that is called metasulfite test. Okay, and there are some other tests. We can also do hemoglobin electrophoresis to identify abnormal hemoglobin. Okay, what are the other abnormal hemoglobins? This is also nice to know. So there is a way to memorize. SCED, SCED, these are all abnormal hemoglobins, and we can all identify these things by hemoglobin electrophoresis. Okay, and we can also do some other tests in fetal life, you know, to identify sickle cell disease. Okay, so before I conclude the discussion, I would like to mention one thing, that there are some factors that influence sickling of a sickle cell. Okay, so suppose a patient has an abnormality, the patient has hemoglobin S. But whether the patient will have sickle cell formed or not, that depends on a lot of other factors. One factor I have already discussed, that is the interaction of hemoglobin S with other hemoglobins of the red blood cell. If there is hemoglobin S less than 60%, and that cell will not get sickled even when deoxygenated. Okay. The second thing is hemoglobin F. Always remember, hemoglobin F gives protection from sickling. That's why a child after birth up to 5 to 6 months, they are protected from sickle cell disease, because up to 5 or 6 months they have hemoglobin F in their red blood cell, and that gives protection from sickle cell disease. Okay, another factor is the pH. Okay, so pH, when pH falls, when RBCs are in acidic environment, they are encouraged to dump oxygen more, so they become more deoxygenated, and that will promote sickling. Okay, so that is another important factor for sickle cell disease. Okay, the last thing is concentration of hemoglobin S. Okay, now suppose a patient has hemoglobin S, a patient has sickle cell disease, but also has thalassemia, also has, say, alpha thalassemia. What will be the problem here, or what will be the outcome? So as the patient has alpha thalassemia, so as a result the overall hemoglobin, remember hemoglobin S was alpha 2, beta S2. Beta S2. So if we are having alpha thalassemia, that is reduced amount of alpha, then ultimately there will be less amount of hemoglobin S formed, right? So those type of patient, despite of having hemoglobin S, will have less chance of sickling. Okay, so the last point we will talk about is the treatment of sickle cell disease. Okay, the treatment for pain, we have to give some analgesics, say for example morphine. If the patient has severe conditions like, say for example, acute chest syndrome or other syndrome, then we have to give exchange blood transfusion. And there is another drug called Hydroxyurea that is very useful in sickle cell disease. The way Hydroxyurea drug works is it increases hemoglobin F, and as we know, hemoglobin F gives us protection from sickling. Okay, so this is in short about sickle cell disease. I hope you go through your textbooks and look at the images and flowcharts so you can have even more clear conception. Okay, so that's all for today. Take care. Thank you.